This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to Al Alexander to start this briefing.
Good morning and welcome to another Ministry of Health virtual media conference, which provides you with clear and accurate information on COVID-19. Our panelists today are no strangers to this media conference. They are Dr. Roshan Parashram, Chief Medical Officer, Mr. Davlin Thomas, CEO, North Central Regional Health Authority, and Mr. Roshan Siram Singh, Geographic Information Systems Manager, Epidemiology Division. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's media conference. I now invite the CMO to present the latest clinical and patient updates.
Good morning, Al. Good morning again to Mr. Thomas, CEO of NCRHA, and Mr. Siram Singh, who is our GIS manager, members of the media, members of the viewing and listening public. So I will begin with the first slide, which is the clinical update as of 20th of June 2021. The total number of public and private tests conducted thus far, 217,371. Over the last 24 hours, we would have reported 106 new positive cases, taking our total since March 12th up to 30,619. Our total recovered patients thus far, 21,608, and our active cases now stand at 8,274, with a total hospital load of 454, and the number of deaths now standing at 737. Those that stepped down account for 148, in quarantine facilities 209, and total persons in home isolation now at 7,566. In terms of our vaccination, we have first doses given thus far at 176,849, and second doses 39,142. If we could go to my first slide in terms of the so this is the breakdown of the patients who are out in the community, not hospitalized patients. You've seen this chart before, so it basically gives a breakdown by county as to where we are at in terms of the percentages attributed to each county. Starting on the top, we look at Tobago, accounting for 2% of the cases in the community. Victoria, 25.3% is still the highest. St. Patrick, 12.0%. Nariva Mayaro stands at 1.4%. Caroni, 17.6%. St. George West, 12.4%. St. George Central, 15.7%. St. George East, 9.1%. And St. Andrews, St. David, 4.7%. So the counties that have been improving steadily, St. Andrews, St. David, Tobago, and Nariva Mayaro, together with St. Patrick. Next slide. This is the clinical case disposition. So number of recoveries, 4.9%. Transferred to facilities, 2.1%. Symptomatic cases, more or less equal to asymptomatic, 48.5% versus 44.4%. Next slide. Breakdown of the comorbidities. We again now seeing a switching of the pattern as I described a couple months ago. We're seeing diabetes and hypertension now accounting for the largest cohort of the entire group. 30.6% of those infected would have had diabetes out of the comorbidity group, and 39.2% having hypertension. Another large group is the asthma-related group, 17.8%. Others include immunodeficiencies, pulmonary disease, heart disease, and other categories, 8.7%. Next slide. So again, this is just a breakdown of those with and without comorbidities. Without comorbidities, 52.1%. With comorbidities, 47.9%. Next slide. Patient distribution by age. So between the 0 and 19 age group, we have about 4% of the cases. 20 to 39, 25.23%. 40 to 59, 32.71%. 60 to 79, 17.73%. And we see an increase in the over 80s, 20.29%, which is a new sort of trend, slightly increasing in that over 80 age group. Next slide. And the last slide that I have is breakdown by male and female, total persons infected remembering this is outside of hospital, 45.2% male, 54.8% female. I believe that brings me to the end of the clinical update for this morning.
Thank you, CMO. Well, we move from the CMO to the CEO of the NCRHA, Mr. Davlin Thomas, who will update us on the operational plan and initiatives to successfully vaccinate persons in the RHA.
Good morning to the Chief Medical Officer, Dr.
Yes.
Dr. Roshan Parasram, the Manager GIS, Mr. Roshan Siram Singh, the Senior Corporate Communications Officer, Mr. Al Alexander, members of the media, TTT staff, members of the public. The 8 NCRHA health centers providing vaccinations are La Hoqueta Health Center, Maloney Health Center, Aruka Health Center, the St. Joseph Enhanced Health Center, Arima District Health Facility, Chaguanas District Health Facility, the St. Helena Health Center, and the Canopia Health Center. Vaccinations that were provided comprise over the last week of the Sinopharm second doses, currently being done at an average of about 200 per health center. The Sinopharm first doses, which are being done via the Elderly Express experience, at an average of 80 to 90 per health center, in addition to the Sinopharm second doses. In case you're wondering, the Elderly Express experience is a highly personalized VIP experience for the elderly. We also have in the arsenal the mobile Elderly Express experience, which provides vaccinations to elderly homes of the elderly, and the UTT campus experience, where for AstraZeneca second doses being administered at the UTT campus at Monroe Road at a rate of 900 to 1,000 per day. The total amount in the last week, the first doses for the administered at the homes of the elderly within the last 3 days would have been 176 doses. Second doses vaccinations administered Sinopharm for the last 3 days would have been, which is at the 14th to 18th of June, 7,745. And the second dose vaccines administered AstraZeneca from the 14th to the 18th, 2021 would have been 3,591. The total first dose vaccines administered for 65 years and over between the 16th and the 18th of June would have been 1,410. Within the last week, the grand total of doses administered by the NCRHA would have been 12,922 within the week. The total vaccine doses, overall doses administered by the NCRHA thus far would have been approximately 56,620. And for that, we applaud the staff for their bias to action and their commitment, and certainly their preponderance and passion and posture for excellence. In terms of oxygen, based on the projections from the NCRHA's Public Health Observatory, we've identified weeks ago that we needed to expand by 20% initially. Then we expanded by a further 30%, and we're running currently at utilization of about 50% of our inherent capacity. Thank you, CMO.
Thank you very much, Mr. Thomas. I now hand you over to Mr. Roshan Siram Singh, who will present the latest GIS update.
Thank you very much. CMO, Dr. Parasram, CEO of NCRHA, Mr. Thomas, Mr. Alexander, members of the media, and members of the listening and viewing audience this morning. Good morning to you all. As we move quickly into our first slide, we take a look, as we move to our first map, we take a look at the spread of cases during epidemiological weeks 18 and 19, which, for reference, represent the period, in the case of Week 18, the 2nd to the 8th of May, and in the case of epidemiological week 19, the 9th to the 15th of May 2021. This is an updated version to a map which was previously shared. A version of this map was shared some time back, but at that point in time, we were in the process of mapping epidemiological week 19. This version, however, gives us a better idea of what the actual spread was like during that particular period. And we see from the map that cases are spread across the entire country. Again, following the typical patterns which we expect, which will be along the populated areas and population centers. And the chart shows us that most of the counties, as a matter of fact, all with the exception of Nariva Mayaro, recorded more cases in epidemiological week 19 when compared to epidemiological week 18. As we move to our next slide, we take a look, again, a similar type of map. We take a look at the spread of cases during epidemiological weeks 20 and 21. In this case, epidemiological week 20 is represented in the purple, by the purple dots and the purple bars on the chart. And epidemiological week 21 is represented by the gold color dots on the map and the gold color bars on the chart. For reference, epidemiological week 20 represents the period the 16th to the 22nd of May, and epidemiological week 21 represents the period 23rd to the 29th of May. I will point out, of course, that we are currently in the process of mapping epidemiological week 21. So this data set is a bit incomplete at this point in time. However, if we were to share what we believe this map will look like in a few days' time when we are completed with mapping epidemiological week 21, we expect, based on the decreasing numbers over the consecutive epi weeks, that the bars which represent epidemiological week 21 will continue to be less or lower than the bars which represent epidemiological week 20. What we see, however, is that epidemiological weeks 19 and 20 are quite similar in terms of the spread and the number of cases in each of the counties. We move across to our next map, which will show the data for epidemiological weeks 20 and 21 aggregated at the community level. And we see that cases are again spread across the entire country, with most communities across all of the counties being affected. In fact, we have approximately 500 out of 590 or thereabout communities having recorded at least one case each. So it means that most of the communities in the country have recorded at least one case, with many communities recording upwards of 50, as we can extract from the map based on the legend, where we see the darkest colored communities have recorded cases, or actually the darkest color communities having recorded cases over 50. We see that these communities are spread across various counties, from St. George West, Central, East, and even St. Andrew, St. David, as well as Carney, Victoria, and St. Patrick. As we move across to our density map for the period epidemiological weeks 18 and 19, we see the pattern continues, whereby we have the highest density of cases being recorded in our population centers and along the east-west corridor, in this case starting from Diego Martin all the way to Arima, with pockets and high densities in Sangre Grande, in Chagonas and environs, a little bit there in Point Fortin and the San Fernando area as well. As we take a look at the density of cases for epidemiological weeks 20 and 21, again, we see the same pattern with the same areas being affected. Of course, I'll mention again that epidemiological week 21 is currently being mapped. However, we expect that when we are completed with this process, the map will look very similar, as the spread appears to be the same. As we move to our chart on our next slide, we see a comparison of cases by county in epidemiological weeks 19, 20, and 21. Again, we would have seen these charts slightly different format in the maps earlier. But what we are seeing is a general downward trend from epidemiological weeks 19 down to 21, with Nariva Mayaro, St. Andrew, St. David, St. George Central, St. George West, St. Patrick, and Victoria all showing that downward trend, which we expect to continue. based on the numbers that we have recorded over the past few epidemiological weeks. And finally, as I come to the end, I will remind everyone that to access credible information, you could visit the Ministry of Health's website at health.gov.tt. For our GIS dashboard, select the COVID-19 drop-down menu and click Trinidad and Tobago COVID-19 dashboard. That brings me to the end of my presentation, so I say thank you very much, and I hand over to Mr. Alexander.
Thank you very much, Mr. Siram Singh. Thank you very much, Mr. Siram Singh. As we move into the question and answer segment, our media representatives are asked to pose their questions to members of the panel and state their name and media house. We are kindly requesting a maximum of 2 questions per media house, and we begin with Guardian Media Limited.
1407.
Guardian Media, ready for your question.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. So my 2 questions this morning are for the Chief Medical Officer. Firstly, CMO, can you just expand a bit for us on the doses of vaccines which we are expecting to receive in the near future, especially with reference to that 800,000 doses or so we're supposed to receive from Africa? And now my second question, now that there is talk of reopening the borders within the coming weeks, I mean, while there are sections of the population who are very happy about this, there are some who are questioning, is now the right time for that to happen, especially given the certain dynamics like the Delta variant, as well as our own vaccination levels within our population. By the time that is forecasted to come, we'd only have vaccinated roughly around 20% of our population. So could you just give us a little bit more details into the dynamics that the Ministry of Health and the government is looking at when it comes to reopening these borders safely?
Both questions were dealt with on Saturday by the Honorable Prime Minister. I wouldn't want to venture into anything further. Suffice it to say, with the second question as it relates to the border, the Prime Minister did mention it is not there will still be policies in place in terms of quarantine. So again, those policies will be in place still, even though you have an open border, as it is in other parts of the world, where different persons, based on their condition, where they come from, whether they're vaccinated or not, will be put into different sections in terms of quarantine. So quarantine will still play a critical role in keeping the country safe from the introduction of COVID-19 and other variants. So I don't want to go beyond that. Of course, we will make recommendations, and other ministries are involved, to the Honorable Prime Minister, and then in the coming weeks, those decisions will be made public.
Thank you, CMO. We now move to CL Communications.
Coming weeks, those decisions will be made public.
Thank you, CMO. We now move to CL Communications. Good morning.
Hi, good morning, everybody. Are you hearing me?
Loud and clear. Please ask your question.
Good morning. Natalie Singh, Caribbean Lifestyle Communications. I was just wondering, what is the procedure when a worker at a long stay home contracts the virus? Does the sanitizing or is the sanitizing part of the protocols that happen whenever contracting the virus? Specifically a worker who is taking care of the elderly in that long stay home. Is sanitizing of the entire building where the elderly stay is part of the protocols? So that's my first question. My second question is that you seem to be pointing towards a downward trend when it comes to the issue of cases. I was just wondering, would this mean that physical classes for schools will be opened come September, given the fact too that we're expecting vaccines, both the Sinopharm and the vaccines from the African Medical Council? Thank you.
So generally speaking, when you have a caregiver in one of the long stay homes getting infected, what happens is that caregiver, of course, is no longer allowed to care for those individuals, generally in the first instance, unless a significant proportion of those people are already infected. So generally what we do is we remove that caregiver from the space, There's testing of the entire group of persons within the facility to determine who is negative and who is positive at that point in time. And we do separation, whether physically separating those individuals or getting them out of the facility as space comes to us. And we basically, in terms of your sanitization question, it is difficult to sanitize the entire facility because, as you know, some of those patients cannot be moved out of the facility to allow for that. So what happens is there's sanitization of particular aspects and shared spaces that occurs, and we do sanitization within the jurisdiction of where the person who was positive would have gone. For instance, if it was one of the patients themselves, we would sanitize that entire area. So it is a very unusual setting where you have people living in a long stay home, and that's why it was critical from the get-go that we sort of ring fence those persons so that we don't let the infection get into that environment, because once it gets in, it tends to spread very quickly because of the way structurally the places are put together and the interaction that is had between individuals in those spaces. So our policy still remains limited visitation, and we are trying to get vaccinated the group of caregivers in the long stay homes, and Mr. Thomas would have indicated what was done at North Central. Same thing is happening in the other RHAs. I think the key to it is to get all of the persons that leave the facility and return to the facility vaccinated, so we create a sort of barrier to those persons getting infected. So that's the main point of call. In terms of the classes, physical classes reopening in September, I think it's a bit early to have that discussion, but either way, the Ministry of Education and the Honorable Prime Minister will ultimately make those decisions. The Ministry of Health will make its recommendation at a later date as it relates to that aspect of reopening.
Thank you for your question and the response from the CMO. We now move to TV6.
Hello. Good morning. I just wanted to find out if we could have an indication as to the number of cases in backlog, so to speak, whether it be testing or reporting, because we're still having persons reaching out saying that they've been waiting weeks to get their results and they have not gotten the results at this time.
Okay, so as far as we are aware, the general, in terms of backlog, there's an improvement in the turnaround time. We're seeing things turn around a little faster than it was at the peak of the third wave. So we're seeing, I would say, 3 to 5 days in terms of persons getting results. If you have someone waiting longer than that, please let us know who they are. We need a name, a phone contact, so that we can, and if possible, an address, so we can reach out to those persons and see what has happened in those instances. But generally, it is about 3 to 5 days to get that turnaround at this point in time.
All right, we will take a follow-up question from CNC3. Guardian Media. Okay. Seems that there is some measure of delay. Guardian Media, we are ready for your follow-up question.
Hi, thank you. I was just having some problems, so unmute the mic there. Okay, so okay, I'm just going to ask the question because I'm having some audio issues. So where is it now that we're seeing these COVID-19 cases propagating from? I mean, we've now been in about 2.5, probably 3 incubation cycles. So where continues to be the sources of these infections?
Generally speaking, where you have movement of people, anywhere you have movement of people, you will tend to see infections coming from. We are seeing a larger proportion of persons, for example, if one person gets infected in a household, with this wave in particular, you're seeing more people. For example, if you have 4 people in a household, first person gets infected from, an example, a workplace, you're seeing 3 or 4 of those household members being infected. So we have household clusters. We have, of course, people are moving to go to essential services still. So police force, the healthcare workers, people in supermarkets, pharmacies, and the like. And I think that a bit of that, in terms of our vaccination strategy, is meant to deal with. So people who really have to be out as part of essential are now being targeted as the last group of people that are fully mobile at this point in time and able to transmit and get those things back to their household. So 2 things coming out of it is just a reminder that if you do have a positive case in your home, that person should be wearing a mask and, as best as possible, isolate within the home to prevent spread to the other individuals. And of course, if you're offered the vaccination and you're part of the essential services, that you really come forward and accept it, any WHO-approved vaccine. So really and truly, we're seeing essential services moving about, which is a fairly large group of people. Looking at P1 variant in terms of transmissibility, and I think Professor Carrington would have said before, it has an R naught of about 5 thereabouts. When you look at the traditional lineage, it's about 2.3, meaning that one case would spread to 2.3 people. With P1 in particular, you find that one case may spread to as many as 5 people. So you see that the cascade of 1 to 5 and then 5 to 25 will be much faster. So it's much easier to transmit. You find that asymptomatic spread is greater at this point in time. People let their guard down a lot of times when they look at someone and they find that they have no symptoms. It's important to keep your guard up at all times. As you know, it's an invisible pathogen. So we want to avoid spread. Wear your mask at all points in time, unless you are by yourself in a secluded environment, and of course, for short periods of time. So it is really, I think, based on the transmissibility of the virus itself, asymptomatic spread, and a lot of other factors that are catering for it. But we do have a large proportion of the public still moving about as part of the essential services.
Thank you very much, CMO. We now move to TTT for your 2 questions.
Hello, good morning. I have a question about persons who employers are refusing to allow them to come back to work unless they pass a PCR test. Is there any redress for persons who, for whatever reason, may have been in quarantine and their PCR test keeps coming back positive, although, and they keep having to dip into their, they're not able to go back to work. They keep having to use up their vacation time and so on. Is there any redress for persons like this?
So generally speaking, the national policy as it remains is not a diagnostic exit criteria, meaning that once you have spent the prescribed period of time in your quarantine based on what the CMOH has put on your form, you don't have to have a negative swab on exit to begin with. So what has been happening is a lot of people from private sector as well doing testing in the private labs have took it upon themselves to have their self-tested, whether at the behest of the employer or otherwise, or on their own. We have seen those people coming back positive, but if you, of course, come back positive, it will be difficult for your employer to let you back into work at that point in time. So what I would suggest is that we follow the national protocol across the board, be guided by the CMOH as to when it is safe for someone to go back out to work, and they will prescribe basically how long you need to stay in your quarantine.
Thank you very much, CMO. We now go back to CL Communications for a follow-up question.
Hi, good morning again. I was just wondering, given the fact that there were issues with the vaccination rollout, what is the picture like now? Has the Ministry of Health declared that, okay, it's smoothed out? What are things to be ironed out if there are still kinks in the system for distributing the vaccines? Thank you.
Well, basically, we're back on track from an operations perspective. We had two very bad days a week or two ago, to the extent where we've now increased the patient to service provider ratios in a lot of the areas. That's to say, for our Elderly Express experience, which has seen thousands of persons, elderly persons vaccinated in a premium setting where they would have received VIP care simultaneously with providing those services for persons or vaccination services for persons who are taking both their first and second doses of Sinopharm and simultaneously second doses of AstraZeneca. We have a standard of about 20 minutes at a site in terms of once you get to the door to the time, 20 minutes to half an hour, 30 minutes or so. And that's the standard we're working with, which has been applauded over the last week or so tremendously. CMO.
All right, thank you very much, Mr. Thomas. We now move to TV6 for a follow-up question. TV6? Okay, seems that we're having some technical difficulties with TV6, so we'll move to AZP for their two questions. AZP.
Hi, good morning. This is Suan Wire from acpnews.com. And my two questions are, first one, some persons who receive their vaccination immunization cards are questioning the security of those because some do not have official health stamps and information could simply be copied. How can this issue, if there is indeed one, be addressed? And the second one is, can you explain the procedure for persons getting second doses of both types of vaccines? Because some persons are getting calls, some are not, some are walking in. So if you can just please explain that. Thank you very much.
Yeah, I'm just trying to understand the issue that you're saying with the first question. Sorry, can you repeat that one? The immunization card, what exactly is happening?
Sure. Some persons who have received vaccinations, they are saying that on the immunization card that they receive, they're not getting like official stamps, and anybody could copy a signature or copy information on another card. So they're questioning the validity of those cards.
So generally speaking, at the immunization site that is given out, there should be a stamp from that institution or from that physician assigned to that particular institution, for example, and even in the private sector drives that we would have been doing. For example, with TTMA, they would have been using their stamps as physicians in some instances to stamp the immunization card. So there should be a stamp on it, whether it is from the public sector or the private sector. There should be a stamp of a physician or an institution that has administered the vaccine. If you don't have a stamp, then we don't deem it legitimate necessarily. So it should be stamped, just for the knowledge of the general public. So if you have gotten a card that is unstamped, please ask the persons at the center to have it stamped for you. Mr. Thomas, I believe, will answer the second question.
Yeah. As at last week, we would have been we've increased the capacity of the personnel that we have responsible for making those calls. So we anticipate that by the end of this week, we should have those appointments for the second doses, particularly AstraZeneca and Sinopharm, those calls completed within the next week. So far, though, I should mention, we would have had between 2,000 and 3,000 appointments made already for the coming week, this approaching week here. So we anticipate that it will run pretty smoothly.
Thank you very much, Mr. Thomas. We go to I-95.5 for the first two questions. I-95.5.
Good morning to everyone. I'm Whitfield Turner from I-95.5. Mr. Alexander, we are having some serious audio issues in the Zoom room, so that would be the reason why there is that extra delay in terms of responses on our end. My two questions this morning, with respect, first of all, to the vaccination process. Persons are still experiencing problems accessing the COVID lines to make appointments for the elderly. And in some cases, some of the numbers aren't even online. So if we can have a listing of all the numbers as it pertains to where you can call to make those appointments, and also one media practitioner who was vaccinated way back in April is still waiting on his call for his second dose here coming down to the end of June. So if we can speak to those two issues, and also for the CMO, it's been explained on more than one occasion, but persons are still having a difficulty. So I'm hoping that your explanation might be able to shed some light on it. They're doing away with the double negative test for discharge. If you can just explain exactly why that policy has been adjusted and there is no longer a requirement for double negative PCR for discharge. Thank you.
Yeah, so your first question, really in terms of operational. So generally speaking, the numbers are online for all the RHAs, the WhatsApp numbers that you can reach out to all our RHAs. Mr. Thomas will probably go into a little more detail with his RHA afterwards. But in terms of your double negative question, we actually changed that policy quite a while ago. I believe it may have been as far back as 2020. So based on WHO's assessment, it really depends on the epidemiological stage that the country is at. So we look at a number of factors. When we were in the first waves, for example, we were in a situation where we had a very small number of cases. We were looking at, and the diagnostic criteria was in place at a world level in terms of WHO's recommendation. WHO changed that recommendation to go to a discharge criteria, which relied on a clinical criteria together with a number of days post-respiratory symptoms. So we adopted that, I believe, in the second phase of the epidemic in Trinidad and Tobago, and we have consistently done so. So the negative upon discharge is not a requirement as a national policy. So we look at the number of days, and again, that is guided by the CMOH having a conversation with the person who is ill. So they determine when your respiratory symptoms end. For example, your cough, stuffy nose, those kinds of things are considered respiratory symptoms. And then they add a certain number of days to that, and they determine how long you need to be in quarantine. Of course, it also is determined by other members of your household contracting the virus afterwards. So, of course, if someone comes on after, maybe 7 days after, contracts the virus newly, then the household sometimes is put a little further down in terms of the number of days before you are released into out of your quarantine situation, out of your isolation situation. So, Mr. Thomas, I don't know if you want to go into any more detail with the first one.
Well, for the most part, though, the appointments for those first visits for the Sinopharm, particularly the elderly, are made via calls from the RHA, to the extent where we utilize two streams, the NCD stream, which would have been mentioned previously, and simultaneously we utilize the database of persons who would have attempted in the past to make appointments. But in addition, we will publish as well this afternoon some hotlines that can be called simultaneously for guidance if someone needs information.
Thank you very much, Mr. Thomas. We now go to the Newsday for your first two questions.
Good morning, Narissa Fraser from the Newsday. Just one question to the CMO. I know that you would have said a report was made to PAHO about one person who had complications after getting the vaccine, and that the person was under the care of Dr. Charles. I just wanted an update on how they're doing. Thanks.
Okay, so yeah, as far as I'm aware, I haven't received any indication that the person has been hospitalized or further, so the status remains similar as I discussed about 2 weeks ago. Yeah, so more or less same sort of status as far as I'm aware.
Thank you very much, CMO. We go to TV6 for a follow-up question. Ladies and gentlemen, there may be a short time delay, which we are trying to rectify. But TV6, are you there?
Hello?
Yes.
I'm just going to continue. To the Chief Medical Officer, I was wondering if you could give an estimate as to when this phase of vaccination would be completed and when we would be moving into the other phase. Is definitely helping to manage the crowds and things like that, but the rate of vaccination appears to be much slower. So I'm just trying to figure out when the general public can look forward to getting vaccinated. And also just for the benefit of the public, would you be able to explain the rationale and also persons coming into the country being vaccinated, given that if and when we reopen our borders, vaccinated persons can still transmit, can transmit the virus, and our vaccination percentage would still be very low.
Okay.
If you could just explain the best considering
would you mind repeating the second question?
These persons.
Okay, so CMO, if you could
All right.
treat
So
with the
yeah.
first
So
question,
when
and then we'll
so
go back to
generally speaking, we had in the beginning we had 3 phases of vaccination. We have phase 1, which was dedicated towards healthcare workers, persons over 60, and those under 60 with some sort of significant NCD, example diabetes, asthma, and the like. All right. So that is our phase 1. Our phase 2 would have been people in parts of certain essential services who would have been at high risk of exposure based on their job. Phase 3, of course, is beyond that, is going into the general population, people under 60, those without comorbidities of any type. So general population. You're asking when can the general population be expected to be included? The answer is predicated upon when we get the vaccine supply, as the Richard would have asked from CNC3. Based on what the Prime Minister discussed, that is something that we are waiting word from in terms of when we will get additional vaccines. He indicated in the press conference that we expect a shipment of further Sinopharm vaccines in the early part of July, and then we go from there. So it is really based on when we get vaccines, how quickly we can give those vaccines to the vulnerable populations first, and then we move beyond. Looking at the total number of persons within, for example, the over 60 category, when you look at the CSO data, it's about 181 to 200 thereabouts. Then you take the NCD persons into account, and of course the healthcare workers, who are again about 17,000. So given raw numbers, we can look towards beginning a full phase 3 sort of approach when we get beyond that first phase in terms of numbers, but I can't say when that will happen unless we are certain when the vaccines will arrive.
Thank you.
In terms of your second question, I think you are asking about the rationale for allowing persons who are vaccinated into the country. I didn't hear the entire question, but I heard bits of it, and it basically says allowing them into the country, and there's still a risk of infection. Granted, there is still a risk of infection from those who have been fully vaccinated, because the one of the vaccines, for example, AstraZeneca, which provides evidence to suggest that the risk of infection, actually being infected, decreases by 67% if you do get two doses and you wait your 2 weeks. Other vaccines have not shown that sort of data as yet. So the chance of getting infected is still there. It is a matter of mitigating or managing the risk. What we have noted is that with the advent of doing a 72-hour PCR on top of vaccination, it further minimized the risk group that is coming into the country. So we will bear all of those things into consideration when we make an ultimate decision as to how long, if there's any quarantine, or how long that quarantine will last. And then, of course, that will be provided to the Honorable Prime Minister, and a final decision will be taken as it relates to the borders.
Okay, thank you very much, CMO. We move to Guardian Media Limited for a follow-up question. Again, you can expect a slight delay. Guardian Media, please.
Hi, morning again. I just would like to follow up on that question with the case of the person who had VITT. How many persons, if any, have we seen since that announcement has been made who may have had some more adverse reactions to any of the COVID-19 vaccines, maybe even VITT itself?
So there was only one other person who is under investigation of Dr. Charles right now. So there's a second person that we think fits the criteria that only came to light about a day ago. That is still under investigation. Seems likely that it may be another case of that syndrome. Again, so that will be 2 cases of that syndrome if it is confirmed, hopefully by the end of today or thereabouts. But yeah, those are the 2 cases that we have seen with that particular event. There have been some other mild allergic type reactions that have been documented where persons would have had allergies maybe about 10 to 15 minutes after having the vaccine. I know of a few cases that had to go to hospital. They have been treated and they are well and they discharged. So there have been to date no vaccine-related deaths of any sort. Most of the persons that would have had the vaccine would have had very mild symptoms lasting 2 to 3 days, generally pain at the injection site, fever, some tiredness. Majority of persons, as I said, have recovered completely within about 2 to 3 days and go back to their normal way of life right after. And some people can continue working even the day after. So the side effect profile has been very good for both vaccines utilized in Trinidad and Tobago, with those 2 instances of severe complications, which are rare again, roughly about 4 in a million for that particular complication. It's a very rare side effect, and both persons continue to be treated as per the clinical guidelines from WHO, and they are still well.
Thank you very much, CMO. We go back to AZP for a follow-up question.
Hi, good morning again. Swan from ACP. I know you mentioned it, CMO, but just to elaborate a bit more regarding the vaccination card issue. If someone has had both shots at the same venue, first and second doses, but their card was not stamped, what exactly should they do? And also, is it safe to say that without an official stamp that your card is not legit? Thank you.
Yeah, so if you have both shots at the same venue, what I'll do is, as I said, advise to go back to that facility and ask them to please place their stamp on the card. I mean, having the vaccines, it will prove that you do have the vaccines, but legitimacy and validation of any official document usually accompanies a stamp and a signature. So those things have to be there in order for it to be, of course, even nationally or internationally utilized.
Thank you very much, CMO. We have our final question from I-95.5. Our final follow-up question from I-95.5.
Hi, good morning again. I don't know if I would have missed it, but CMO, regarding the vaccination, and it's actually a media worker who has been vaccinated since the 24th of April, and they're still waiting on that call for the second shot. What advice would you have for such persons?
Yeah, so again, it's an anomaly, because generally speaking, what you had noted, if it is the AstraZeneca vaccine, we had said originally it should be 8 to 12 weeks, and a lot of people had gotten a 12-week appointment, which was brought forward by the RHAs. So if you can pass that person's information offline to us, we will ensure that they are vaccinated within the stipulated period of time at one of our sites.
Thank you very much, CMO. And I too have one or two questions, if you would oblige. What does it mean to be fully vaccinated, and can a fully vaccinated person still contract the virus?
Sure. Yeah, so fully vaccinated, and I believe we have it up on our website now, is a person that has received the requisite number of a WHO-approved vaccine and has waited 2 weeks after the final dose of that vaccine. So, for example, for AstraZeneca, you basically have 2 doses 8 weeks apart, 8 to 12 weeks apart, and after the second dose, you wait a further 2 weeks. You can be considered a fully vaccinated individual at that point in time. For example, if you have the Johnson & Johnson vaccine, which is a 1-dose vaccine, you have that vaccine and you wait 2 weeks, you can be considered fully vaccinated at that point in time. And as the question related to the quarantine posed, there is still a risk that you can be infected, albeit most vaccines are built to prevent severe disease and death, but you can still be infected. So you still have to follow the guidelines, wear your mask, watch your distance, and importantly, especially if you're around vulnerable people, and you are a vaccinated person, whether it's 1 dose or 2 doses, you should still be cognizant that you can be infected and transmit that onwards to someone who has not been vaccinated, for example, elderly person or a child, for example, and put those persons at risk of COVID and its complications.
Thank you very much, CMO. Ladies and gentlemen, we have come to the end of today's media conference. Thank you for sharing your time with us. Please note the vaccination rollout continues in all RHAs for persons 65 years old and over. Remember, to be fully vaccinated, you must get your second shot, and even though you are vaccinated, you still need to practice the 3 W's, as the CMO just emphasized. Wash your hands, watch your distance, and wear your mask. Have a good day, everyone. Stay safe, and goodbye for now.
I will make food security a reality.
I will design groundbreaking prototypes.
I will create the next life-saving vaccine.
Whatever your career aspirations, the University of the West Indies St. Augustine campus is where tomorrow's game changers begin their journey. With fully accredited programs across 8 faculties, our graduates are innovating regionally and impacting globally. See what it's like to be UE. Visit sta.uwi.edu/apply.
Everything has been running smoothly since the beginning, and we can expect that will continue to run smoothly, and we will achieve our target.
So our goal, fully vaccinated by July 2021, is 188,900. Right, so we are on stream to achieve our targets by July, to have over 10% of the population fully vaccinated.
I am taking the vaccine for myself and my son who is disabled at home.